Question. A client receiving parenteral nutrition has a history of congestive heart failure. The physician has ordered Lasix 40 mg by mouth daily to prevent fluid overload. The nurse monitors which laboratory value to identify an adverse effect from this medication. Options: first one glucose, second one sodium, third one potassium, fourth one magnesium. So the answer is the third one, that is potassium. So furosemide or Lasix is a non-potassium sparing diuretic, and insufficient replacement of potassium may lead to hypokalemia. Although the glucose, sodium and also the magnesium levels may be monitored, these values are non-specific in this case of administering Lasix. So answer is third one. Question. A client with history of angina pectoris tells a nurse that chest pain usually occurs after going up 2 flights of stairs or after walking 4 blocks. The nurse determines that the client is experiencing which type of angina. Options: first one stable, second one unstable, third one variant and fourth one intractable. Answer is stable angina, the first option. So the rationale is the stable angina is triggered by predictable amount of effort or emotion, and the second one unstable is triggered by unpredictable amount of effort. So in this question also they have already mentioned regarding the amount of effort that the patient had taken, because 2 flights of stairs and also walking 4 blocks, so it is predictable. So the answer is stable angina. And talking about the variant and intractable, variant is mainly due to the coronary artery spasm, and intractable, it is very chronic condition and it is refractory to medical therapy. So in this question the answer is the first one, stable angina, which is predictable. Question. A client with first degree heart block has an ECG taken during the episode of chest pain. The nurse knows that which ECG finding indicates first degree heart block. Options: first one prolonged PR interval, second one widened QRS complex, third one tall or peaked T waves, fourth one presence of Q waves. So first degree heart block, the answer is first one, prolonged PR interval. So the second option, when we consider regarding the second option, that is a widened QRS complex, it mainly occurs when delay in intraventricular conduction occurs, which is commonly in bundle branch block. And this third one, the tall or peak T waves, indicates hyperkalemia. And the fourth one, the Q wave development, it is seen in myocardial necrosis. So when we take ECG during the pain, if the patient is having first degree heart block, the expected outcome is in the ECG is prolonged PR interval. The second one, ST segment elevation or ST segment depression. These 3 changes are mainly occurring in the patients who is having the first degree heart block. So the answer is of course the first one, prolonged PR interval. Question. A home health nurse is visiting an older client whose family has gone out for the day. During the visit, the client experiences chest pain that is unrelieved by 3 sublingual nitroglycerin tablets given by the nurse. Which action by the nurse would be appropriate at this time? First option, notify the family member who is the next of kin. Second one, inform the home care agency supervisor that the visit may be prolonged. Third one, call for an ambulance to transport the client to the hospital emergency department. Fourth one, drive the client to physician's office. So in this the answer is the third one, call for an ambulance, because the chest pain is unrelieved by 3 sublingual nitroglycerin tablets. So it is of course an emergency situation. All the other options will take definitely time. So considering it as an emergency, the answer is third one, call for an ambulance to transport the client to the hospital emergency department. Question. An ambulatory care nurse is working with a client who has been diagnosed with variant angina. The nurse plans to reinforce the client that this type of angina, and the options, first one, is most effectively managed by beta blocking agents. Second one, generally is treated with calcium channel blocking agents. Third one, has the same risk factors as stable and unstable angina. Fourth one, can be controlled with a low sodium, high potassium diet. For this question, the answer is the second one. Generally is treated with calcium channel blocking agent. So the variant angina results from the spasm of the coronary vessels, and it is treated with calcium channel blockers. The risk factors are unknown, and this type of angina is relatively unresponsive to nitrates, and beta blockers are also contraindicated here because they may actually worsen the spasm. And the fourth one, the diet therapy is also not specifically indicated. So mainly the variant angina is treated with calcium channel blocking agents. The answer is the second one.